This video is made in partnership with the Philippine College of Surgeons and the Academy of Filipino Neurosurgeons. Hello, I'm Dr. Alcazaren. I'm a board-certified neurosurgeon practicing in the Philippines and a fellow of the Academy of Filipino Neurosurgeons, AFN for short. I've been practicing neurosurgery for 8 years, and I currently serve on the Board of Trustees of the Academy. More specifically, I head the Committee on Neurosurgical Practice and Workforce. My work focuses on assessing the current and future neurosurgical needs of the country. Part of this role is to give talks to young aspiring doctors as well as doctors who have just finished medical school, encouraging them to consider neurosurgery as a career path. It's a demanding but fulfilling specialty, and today I'll walk you through the reasons one would want to take neurosurgery, what it takes to become a neurosurgeon, the challenges involved, and the impact we can make. My hope is that at the end of this talk, I can persuade some of the best of you to apply to residency. Let's get right down to it.
Okay, folks, let's get started.
What is neurosurgery? Neurosurgery is the field of medicine that involves the diagnosis and treatment of diseases affecting the central and peripheral nervous system. This includes the brain, the spinal cord, and the peripheral nerves. This includes both surgical and non-surgical treatment of these conditions. And we treat both adults and pediatric patients. We can also subdivide surgery into emergent surgeries and non-emergent or elective surgeries. Common conditions we treat are generally lumped together in different subspecialties of neurosurgery. First, we have neurosurgical oncology. This deals with brain tumors, both benign and malignant, as well as diseases involving the surrounding skull base. Examples are benign meningiomas and schwannomas, more aggressive tumors like chordomas and astrocytomas, and then all the way up to the malignant lesions like glioblastomas and metastatic lesions. The subspecialty that deals with blood vessels of the brain and spine is vascular neurosurgery. Illnesses such as intracerebral hemorrhage, subarachnoid hemorrhage, and intraventricular hemorrhage are within its scope. Also included are ischemic stroke and its complications, which neurosurgeons can treat through mechanical thrombectomy, decompressive procedures, CSF diversion. Intracranial aneurysms, both ruptured and unruptured, AVMs or arteriovenous malformations, and AV fistulas are also treated by vascular neurosurgeons. A subset of vascular neurosurgery is endovascular neurosurgery, which utilizes endovascular interventions as a means of treatment. These include coiling, flow diversion, and AVM embolization. The treatment of traumatic brain and spine injuries falls under neurosurgical trauma. These include the diagnosis and treatment of injuries to the brain and spine brought about by accidental and non-accidental trauma. These include epidural hematomas, acute subdural hematomas, skull fractures, and penetrating brain injuries such as gunshot and stab wounds. Neurosurgical trauma also deals with intensive and critical care management of such patients. Pediatric neurosurgery deals with neurosurgical treatment of both congenital and acquired diseases of the brain and spine. Examples are congenital diseases such as obstructive hydrocephalus, spina bifida, or tethered cord syndrome, and craniosynostosis, to name a few. Acquired pediatric neurosurgical disease such as tumors, infections such as bacterial and tuberculous abscesses, and meningitis complicated by obstructive hydrocephalus are also in its scope. Spine neurosurgery, on the other hand, treats diseases like degenerative spondylosis, benign and malignant spine tumors, spine infections like tuberculous and bacterial spine abscesses, among other things. Then there's functional neurosurgery, which deals with the treatment of patients with movement disorders, such as tremor, dystonia, and Parkinsonism. Pain disorders and epilepsy are also treated. The modalities that functional neurosurgeons can utilize include open surgery, focused ultrasound, deep brain stimulation, ablative procedures, and neurostimulation. These fields just scratch the surface of the field of neurosurgery, and even as we speak, there are evolving subspecialties. Our work deals with some of the most critically ill and vulnerable patients, which gives neurosurgeons a unique opportunity and responsibility to improve patient outcomes. Now, why would somebody choose to become a neurosurgeon? Well, I could think of a couple of practical as well as philosophical reasons that will draw a doctor to neurosurgery. Number one, you enjoy precision work. Neurosurgery requires a level of precision where even the smallest error can have life-changing consequences. Small hand movements that are assisted with operative microscopy or endoscopy are the norm. We use micro-instruments that are sub-millimeter in size to dissect very delicate arteries and nerves, for example, when performing microvascular decompression for hemifacial spasm. Patients with hemifacial spasm have uncontrollable facial twitching caused by a branch of the anterior inferior cerebellar artery that irritates the dorsal root entry zone of the facial nerve. Physical separation of this nerve from the artery alleviates the patient's distress and discomfort from uncontrollable facial twitches. When you dissect the pituitary adenoma from the optic chiasm, you have to take care to free the tumor capsule from the optic nerve, while at the same time making sure not to injure the optic nerve itself through excessive manipulation, because inadvertently damaging it would result in devastating blindness. Ruptured intracranial aneurysms that are nearly 2 millimeters in size around its neck need to be clipped or coiled in order to prevent a re-rupture, with a subsequent mortality rate of upwards of 60%. As neurosurgeons, our margin of error is usually measured in millimeters or less. Number 2, you take pride in making an immediate and dramatic impact on patients. As neurosurgeons, we take care of some of the most ill patients whose diseases can take a very acute and fulminant course. For example, a patient with a large 100cc epidural hematoma following a car accident has almost no chance of survival. But with a timely craniotomy, they have a chance for an excellent outcome. That person, with appropriate and timely care, can return to their work and family. Because our patients are very ill, they are also very vulnerable. And because statistically, neurosurgeons are very few in number, only a handful of people can actually help a person in a decisive manner at a particular point in time. Sure, there may be many practicing neurosurgeons in a certain area, but if a patient gets a stroke or gets into an accident and you are the attending on call, then it's usually you and only you who can help him. Number 3, and more practically, you are drawn to innovation and research. Neurosurgery relies heavily on technology, from operating microscopes to advanced imaging tools. The brain is such a complex and sensitive organ that small manipulation to its structure can affect patients dramatically. Throughout early history, humans have already tried to enter the skull and the brain, often not successfully. Take this image, for example, of skulls preserved from the Bronze Age at the Archaeological Museum of St. Raphael. Look at the holes in the skull, which at first glance would appear to be a blunt, penetrating skull injury. Note that there are no comminuted openings, meaning the skulls showed signs of purposeful perforation from a sharpened instrument, which means that someone tried to enter this person's brain to remove something. Now, take a look at this painting by Bosch, which was done in 1488. This painting is called The Stone of Madness, which shows the ancient medieval practice of trepanation, or the act of drilling a hole through the skull to expose the dura mater. Suffice it to say that the vast majority of patients who underwent this procedure probably didn't survive because of exsanguination or fulminant infection from the wound. Pre-modern neurosurgical mortality was usually above 90%. Usually it's like 100%. This extremely high mortality rate would continue for centuries until this doctor, Dr. Harvey Cushing, an American surgeon, developed technological advances and techniques which until today serve as the basis for modern-day neurosurgery. He improved the survival of patients after difficult brain tumor excision and reduced the mortality of brain surgery from 100% to less than 10%. For example, he used X-ray to diagnose brain tumors. He advocated for sterile technique prior to operations, used electrical stimuli for the first time for the study of the human sensory cortex. He even developed the electrocautery machine with William Bovie. By the time he retired, he removed more than 2,000 brain tumors. Dr. Cushing was clearly a giant among men. But countless other neurosurgeons followed in his wake, creating innovation after innovation that made neurosurgery as safe as it is today. Going by decade, neurosurgery itself is an infant specialty, but because of these advancements, evolved into a powerhouse specialty that it is today. One that is cutting edge, high reward, and most importantly, incredibly cool. The reality is that neurosurgery offers incredible personal reward, But it's also a high-stakes and demanding field where even with our best efforts, the outcomes aren't always what we hope for. So in the first part of my talk, I explored the reasons why you would want to be a neurosurgeon. The next part is why you need to become a neurosurgeon, or rather, why the Philippines needs you to become a neurosurgeon. Because of the research efforts of a distinguished group of Filipino neurosurgeons from the Academy, we now have factual data on delivery of neurosurgical care in the Philippines. A workforce map was made, including the distribution of clinical practice of neurosurgeons across 17 regions and 81 provinces of the Philippines. What this workforce map means in a nutshell is that our country needs more neurosurgeons. This lack of neurosurgeon density becomes dire when compared with the rest of the world. North American countries considered as high-income countries have 1.82 neurosurgeons per 100,000 population. Our East Asian neighbors, Japan, South Korea, and Taiwan, they have more than 3 neurosurgeons per 100,000 population. What about us? Well, we have 1 neurosurgeon per 650,000 Filipinos. Let that sink in. A single neurosurgeon serving more than 500,000 patients. According to the Philippine Statistics Authority, the current population in 2024 is estimated to be around 114 million Filipinos. And the total number of Filipino neurosurgeons is currently 181 active board-certified neurosurgeons. That leaves us with approximately 1 neurosurgeon for every 650,000. Does that sound insane? It is. It's physically impossible for every currently practicing neurosurgeon to service 650,000 souls. And unfortunately, many Filipino patients will fall through the cracks, especially the poor demographic. It gets worse. The PSA estimates that the population will balloon to 145 million by the year 2055. There is also an unequal distribution of neurosurgeons. This is the workforce map of the Philippines, the geographic map showing the approximate population served by part-time and full-time neurosurgeons in each of the 81 provinces. Data for population used in this study was for the year 2020. As you can see in the graph, there is a gross disparity between the provinces and the number of neurosurgeons servicing a particular area. Highly industrialized areas like Metro Manila, Cebu, and Davao have the highest concentration of specialists. But this also shows that there are some areas with a high population with absolutely no neurosurgeon. Provinces such as Romblon, Marinduque, have no practicing neurosurgeon. Masbate, with a population of 900,000, has no neurosurgeon. The Bangsamoro Autonomous Region, with more than 4 million people, have no neurosurgeons servicing that area. Patients from these areas have to travel by sea or air if they require neurosurgical care. And like I said, time is of the essence, or rather, time is brain. Some of these patients do not even reach the neurosurgical center. A large part of the population has limited or no access to neurosurgical care. More specifically, 1 out of every 5 Filipino does not have access to a neurosurgeon. Most neurosurgeons, around 39%, are based in Metro Manila, which is to be somewhat expected because a neurosurgeon can only operate where there is adequate equipment to perform such delicate surgery. This shortage affects the quality and timeliness of care, and part of the AFN's mission is to address these gaps through better distribution and training. So, now that you decided to begin your journey into the specialty, how exactly does an aspiring Filipino become a neurosurgeon?
Dati pinapangarap lang kita. Pero ngayon, abot kamay na kita.
It takes 4 to 5 years of college, usually in a pre-medical course or an allied medical profession. Or it can be any course which has some extra credits taken to fulfill requirements of a particular medical school. Then there's 4 years of medical school, followed by 1 year of internship. And only then can a doctor apply as a resident trainee. All board-certified training institutions in the Philippines are straight programs consisting of 6 years of neurosurgical residency training. Curricula of every training institution will vary from program to program, but usually, in the 6 years of neurosurgical residency, 1 year will be in general surgery and 5 years in neurosurgery proper. So if you start right after high school, the earliest you can become a board-certified neurosurgeon is around 31 or 32. Needless to say, training a neurosurgeon is a lengthy and inexplicably costly endeavor. Now, where can you apply for neurosurgery training? Well, as of the moment, there are 14 training programs that trains neurosurgeons in the country. The accrediting body of neurosurgery in the country falls upon the Philippine Board of Neurological Surgery. Compared to other cutting specialties, the number of training programs is a relatively small number, and for good reason. The PBNS has very strict guidelines for accrediting institutions that train people who can open up people's brains. Here are the list of all the training programs, the links to which I will reference at the bottom of this video. I will also leave an email so that any inquiries can be forwarded to the respective programs. All are excellent training programs, in my opinion, and offer high-quality training. The training programs follow a standardized 6-year curriculum. So, what does it take to succeed as a neurosurgeon? You might want to be a neurosurgeon, but does neurosurgery want you? How do you know? Well, first, academic excellence, of course. Neuroscience, anatomy, and physiology would come naturally to you. Objectively, this can be measured by your scores in med school, such as neuroanatomy, anatomy, neurophysiology, and the neurosciences. Number 2, manual dexterity. You need steady hands and fine motor skills to operate in small spaces. This is a soft requirement, as dexterity can be both learned in residency and augmented by instrumentation and stabilization. Number 3, resilience and compassion. Neurosurgeons deal with patients and families at their most vulnerable, so effective communication and emotional strength are very critical. We need neurosurgeons who can speak clearly and unambiguously, describe diseases precisely, and think in an organized manner. And most importantly, to convey these thoughts to the patients and their relatives. Number 4, the ability to handle death. Not every surgery will be a success, and you'll need to learn how to cope with difficult outcomes. Lastly, grit. Neurosurgery has a bad reputation as being one of the most difficult residency programs. The toxicity stems from the sheer workload as well as the nature of the specialty. Make no mistake, it's a very demanding lifestyle which can be contrary to the image of neurosurgeons portrayed in mainstream media. The truth is that neurosurgical residents are one of the most overworked and stressed out doctors in the hospital. The program doesn't need to make life toxic, it just naturally is. Being a neurosurgeon isn't just about performing surgeries. We also train future residents and fellows. We teach medical students neuroscience and neuroanatomy. We collaborate with NGOs, for example, the Hydrocephalus Foundation and Stroke Society of the Philippines. Our work extends beyond the operating room. We are educators, mentors, and advocates for improved healthcare. In conclusion, neurosurgery is one of the most demanding, yet fulfilling careers in medicine. It offers one a chance to make a profound impact, but it requires dedication, precision, and resilience. The need for more neurosurgeons in the Philippines is urgent, especially in rural areas. And if at the end of this talk that you feel called to this path, I encourage you to pursue it wholeheartedly. Talk with any neurosurgeon that you know and ask about residency. I would also be happy to receive any questions about training, whether in person or through my email. Thank you for your time. I'd be happy to answer questions that any of you may have.